Hello, and welcome to our COVID-19 update, where we'll be talking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister, and thank you for speaking with us today.
Well, good day to you, and thank you for having me on the program.
Okay, Minister, so let's just jump right into it. Can we have an update on the Infectious Disease Control Center at Liliendal?
Yes, as you know, we've started using that facility for some time now, and the persons who we had there were mostly mild patients. However, those persons would have required some form of isolation, and we've been using the facility in that way. But as of Friday, what we've been able to do is transfer all the ICU patients that we have at GPHC over to the Ocean View facility. We have the capacity there that is much larger than GPHC because GPHC was catering for about 15 patients. At Ocean View now we have capacity for 25 patients with an additional 4 in another area. So technically we can have at least 29 patients who are severely ill, and we would be able to comfortably manage them at Ocean View. It took us a while to get the ICU up and running, but all the things that are necessary for an ICU are now in place. And we currently have at Ocean View now in our infectious disease ICU there 14 patients.
Thank you for that update, Minister. Now, recently a number of upgrades would have been announced for health facilities such as in Lethem and Mabaruma. Can we get an update on the works going on there? Have they started?
Yes, as part of the Smart Hospital initiative, we've been looking at 5 facilities for upgrades. And the first one was Diamond. We've now just started Lenora. And we have already given the contracts for Mabaruma and Lethem. And the idea behind what we're trying to do here is to make these facilities more climate resilient, meaning that to prevent any flooding, to prevent any other adverse climate events. And the other thing that we're working on is to make sure that we reduce the energy cost of these facilities. So we have been putting in solar panels and being able to generate a lot of our electricity using solar power. This would obviously cut the cost of power consumption, and it would make it more cheaper to run these facilities. In addition to that, internally we are retrofitting the facility because in a lot of cases how our facilities have been built, we would basically start out with maybe a small building and then add pieces to it. And so over time it becomes very cluttered and it's not really structured. So what we are doing with these retrofitting is to ensure that you have a smooth flow, a more efficient way of patients getting from one area to another. And of course, given the challenges that we have with COVID now, we are ensuring that all our facilities would have adequate waiting area with adequate space so that patients don't have to be clustered up together.
You mentioned the works would have commenced at Lenora. Can you give a timeline as to when they will be completed?
Generally, all projects would have a 1-year completion date. However, as in the case with Diamond, the contractor has been able to do this in a very constrained time period. So he didn't spend too long there, but he has been able to finish the work. So that's something, if the contractors can finish before time, we'll welcome that. But of course, we don't want to compromise on quality. So the outer limit is a year, but if they finish and complete all the things that are necessary for us within a shorter time frame, then we certainly would welcome that because we want to return the facility to use as quickly as possible.
Okay. And Diamond is completed or it's almost finished?
The works internally is almost done. They might have a little bit here and there to finish off, but we are anticipating that the building can be handed over sometime in December. But however, they will have to continue doing some works outside of the building. So once they finish those works, I think they would still be way ahead of schedule.
And with the contracts awarded for Mabaroom and Latham, when are works expected to commence for those two?
Well, once the award has already been made, so the contractor would be mobilizing and starting the works. They should have started already.
Okay. Thank you for that, Minister. Now, the Ministry of Health would have recently advertised the construction for a storage bond. Can you say if this is in preparation for the COVID-19 vaccine?
Yes, it's not only that one bond that we are talking about, but we have regional storage facilities for vaccines, and we have been doing an assessment of the regional storage facilities that we have. We'll be upgrading all of them to ensure that they have the capacity to be able to manage a COVID-19 vaccine. So within the next few weeks, all these facilities would be upgraded, expanded in some cases because we need additional space. And we will be adding new freezers appropriate for the types of vaccines that we'll be getting. And also in some cases we'll have to do some power upgrades because, as you know, we'll have to keep these vaccines at a certain temperature, and if in some cases we need backup generators, then we'll have to put those in place as well. So that work has started. A team is going around to all the facilities to do the assessment, and based on the assessment we'll start doing the upgrade shortly.
Okay. Minister, has the specialized team for the rollout of the vaccine been appointed?
We have a number of persons who we have identified, and we'll formally bring them together during this week.
Okay, so at this point in time you can't say who will be heading the team?
We'll announce it soon.
Okay, Minister, thank you for that. Now, in closing, can you give us an update on a few of the indigenous villages? What are the numbers like in Oriala and Siparuta?
Well, in Siparuta we have now, I think, 39 cases, and in Oriala we have maybe about 10 less. So we continue to monitor the situation. In fact, in Siparuta we have 49 cases, and in Oriala about 31 cases. So we continue to monitor what's going on. We have our medical team there, and we probably would see a slight increase, and then we'll start seeing the decrease. As you know, the village council itself has imposed some travel restrictions, so that's going to help in terms of bringing down the numbers, decreasing contacts with other people so as to prevent spread. So those are good measures. In Bartica, we have about 66 cases, and that's an area of concern, and we have been monitoring what is happening there. So we'll continue to do so. We have a medical team on the ground, and they have been constantly updating us as to what is going on. The other areas where we've had some challenges would have been in Region 1, but those numbers have come down quite nicely. We are watching a little spike in Linden in Amelia's ward, but that's something that we'll keep monitoring. We have about 22 cases up there.
Okay, Minister, what about St. Cuthbert's Mission? The lockdown has been lifted. What happens now?
Well, basically, we continue to monitor because there are still a few active cases. And by now, I think most of the residents understand the importance of wearing masks and taking the precautions, because while a number of persons would have been infected, it's not the whole village. So they're still people there that are vulnerable, and if they don't take precautions, we can see, infection starting to spread again. So I think the medical team that has been there has worked, quite intensely with the population, and I'm sure that message is quite known now in the village. We felt confident that we can lift the lockdown, and we want to thank the joint services, the village council, all the persons who worked with the health team to ensure that we have reduced the numbers drastically in St. Cuthbert's Mission. So, but we'll continue to monitor because we don't want to see another spike there.
Okay. Thank you for that, Minister, and thank you so much for your time today. This has been our COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.